Hello, welcome to this course. My name is Joy Hunoche. As you already know, this first lecture will be talking to us about the objective structure clinical examination, giving us an overview of what the exam is all about and why you're taking it, why the UK is making you take this exam before you become qualified as a UK midwife. So why the OSCE? First off, the OSCE is objective structure clinical examination. That's the full meaning, and it just goes to help us to understand how the UK practice is. For nurses, it tells them how the UK nursing practice is, while for midwives, it tells us how the UK midwifery practice is, how midwifery is practiced here in the UK, what you're expected to do as a midwife working in the UK, the different skills you will carry out on a day-to-day basis. Before I took my own examination, it seemed very daunting to me. It seemed very difficult to me, like this thing is just a stressful thing to do. But as time went on, I realized that this was something I needed to do every day of my life as a UK midwife. So this is something you will meet every day. So you better, get used to it now that you still have that, privilege. The OSCE examination is part two of the test of competence for midwives or for nurses. We're basing on midwifery now, so it's a part two of the test of competence. You've already had the part one, which is the CBT examination, the written one. So the part two is the clinical one, the practical one, the one you exhibit your skills as a midwife. You tell them this is what I can do, this is what I'm capable of doing, this is how best I can practice and all that. So you're assessed based on what you can do. You're assessed based on your clinical skills and your communication skills. Okay, so this examination has 10 stations, all right? And recently, I think from June 2023, they added like 3 stations to it as well. But this does not change the number of stations you are expected to take as a candidate. It still remains 10 stations. So we have the first four, which is like sort of like a paired station. The API, the assessment, planning, implementation, and the evaluation stations. These four are paired to help you to exhibit or carry out the midwifery care planning skills that you have. All right. So remember when you were in school, when you were in the school of midwifery, you were taught the nursing care plan, the assessment, planning, implementation, evaluation, ADPI or API, depending on where you went to school or what stage you were taught this. But here in the UK, they're modifying it to, midwifery care planning. It's still the same nursing care plan, but you're applying it to midwifery. That's API. Assessment is the first one. It just basically has to do with assessing your patients, head to toe examination. We're going to be talking about this in details anyways in the next subsequent videos and other subsequent classes, but it just has to do with assessment. Basically it has to do with assessing your patient, whether you're giving an antenatal patient, labor patient, postnatal patient, or it all has to do with assessment. The second one is the planning, the care planning. It basically involves you planning the patient care. The next one is the implementation, as the name implies, implementation. All right, it just has to do with you carrying out a particular care. I will not be dwelling much in details about this. I will just go ahead because we'll be talking about it as well again. And the last one is the evaluation station, which has to do with evaluating the care you've already given. It's as simple as ABC. It's something you've done before, but this time around you're doing it in a more advanced setting, if you understand what I mean. Then the next skills you expect to do, or the next stations rather, is the normal stations. I would class them as normal and abnormal at this point. So we have two normal stations that you are expected to carry out, and we have two abnormal stations as well. So the normal clinical skills rather, it involves things like the birthing scenario, like you're carrying out a second stage of labor birth. It involves postnatal check. You're carrying out a postnatal check on a lady that's already delivered. It involves systematic examination of the newborn. And also there are 3 skills, like I mentioned at the beginning of this video, that has been added to these normal skills, which is the removal of urinary catheter. It's the intramuscular injection, that is the IM injection, and then the IV flush and VIP scoring system. So these three were added based on the fact that NMC figured that these things are important for candidates to know before they, enter the UK practice. So they added these skills to help. And to be fair, I would say it's very important for you to do these things in the OSCE before you actually go into practice, because you will carry it out every time. Okay, so these are part of the things that are in the normal, that within the normal skills or the normal stations. As a candidate, you're only expected to carry out two of those normal skills, but you will learn everything because you don't know what you will be given on the day of your exam. Okay, you have to learn everything. You will learn both the practice or learn both the birth scenarios, learn the postnatal check, learn the removal of urinary catheter, the systematic examination of the newborn, the intramuscular injection, and the VIP or an IV flush, system. And then we have the abnormal stations as well. And as a candidate, you also expect to carry out at least two of these abnormal stations. The examiner will be the one to give you the ones to carry out. So what are the abnormal stations? We have the postpartum hemorrhage, we have the postnatal sepsis, we have shoulder dystocia, we had unexpected breech birth. So these are the four things that are within the abnormal or the obstetric emergency stations. We call them the obstetric emergencies then because they are obstetric emergencies. They are midwifery or obstetric emergencies that you have to carry out in a rush in an emergency scenario. Okay, so these stations usually have a very short time, because you're supposed to carry them out within a short time to save the patient's life if you're in an actual clinical setting. That's why it's rushed, and that's why it's very, very short as well in terms of timing, which I'll talk about later. So we've mentioned like 4, 6, 8 now. So 4 for the first one, which is the API, assessment, planning, implementation, and evaluation. We have the 2 normal that you expect to take, carry out, which um, are the birth, the postnatal check, the intramuscular injection, systematic examination of the newborn. We have the removal of urinary catheter and IV flush and VIP scoring. So within these ones, you expect to carry out at least 2. The out of those 2, you know that you're definitely carrying out the systematic examination of the newborn. There is no two ways about it. So systematic examination of the newborn and one of the other ones. Then you have the 2 abnormals now, which is the postpartum hemorrhage, shoulder dystocia, unexpected breech birth, and postnatal sepsis. So out of these 4, you expect to carry out 2 of them, compulsorily. So these are 8 now. So the last 2 is the written stations, which is the professional value station and the evidence-based practice station. So these ones are written stations, they're silent stations, and you don't need to talk about them when you're writing it. You just basically write it and submit it. And these usually come last most of the time, although I don't know if some examiners want to put it first, but most of the time they come last. The API come first, depending on what they give you. Sometimes it can change, so don't expect this to be first or last or second or third or anything. Just do what you're given, the questions you're given, answer them. Okay, so now that we've talked about the 10 stations, if you don't understand, you can watch this again, but like I said, we'll be dwelling on them individually with the subsequent time. um, Now we're going to talk about the timings. Okay, so the timing of the API, the timing of the normal skills, the timing of the abnormal skills, the timing of the silent stations. We're going to talk about them. The API for the assessment takes 20 minutes for you to complete. You expect to complete an assessment of the woman or the whoever you're giving is usually the woman, whether it's an antenatal woman, postnatal, yeah. So talking about antenatal, postnatal, and this thing. So for the API stations, you're assessed based on three scenarios: either the antenatal scenario, labor scenario, or postnatal scenario. So it's either of these ones. The examiner can give you a birth case now, saying that this woman came in second stage. How would you assess the woman? So you're given an API scenario based on a birth situation. Or you can be given an antenatal woman, a lady in 34 weeks gestation, 36 weeks, 37, 28, coming to you for care. How would you assess this patient? How would you plan her care? How would you implement the care? How would you evaluate the care? So you understand that they either give you an antenatal, labor or postnatal. These are usually the three stages of midwifery anyways, the three phases that you usually walk around in midwifery. So I didn't want to skip that out because I kept on mentioning that. So talking about the timing, like I said, the assessment takes 20 minutes. All right. You're expected to carry out an assessment of the patient from head to toe within a period of 20 minutes. So whatever you're doing it really fast. And don't look at it like this thing is very short, that this thing is very long, rather that the 20 minutes is a very long time. It's the shortest time you can never imagine in your life. It's very, very short, okay? Because you're doing a lot of things, you are doing a lot of things. So these are usually short times that we're given to carry out this skills. So whatever you're doing, make sure you're doing it really fast and you're doing it, competently as well. The next one is the planning stage. The planning stage usually takes like 14 minutes. The next one is the planning stage. The planning stage usually takes like 14 minutes. So in a period of 14 minutes, you're expected to carry out planning of the care that the lady you've just assessed, you're expected to plan her care within a period of 14 minutes. Okay, so this stage is now a written stage, like it's now a written stage in your examination, or the thing you're carrying out. So before now, they used to say, you write this thing and then you present it to your examination, but now you only write it, you don't present it anymore. You understand? So for the implementation, you're definitely carrying something out, so you're presenting it. Then the evaluation, you simply present it to your examiner after writing as well. So it's like they switch the evaluation the evaluation scenario with the planning scenario, meaning that what you usually do in planning before is now what you do in evaluation. So you write it and you present it to the examiner that this is what this is what you've done in an SBAR format: situation, background, assessment, recommendation. Don't worry about all of this if you don't understand yet. We'll do this properly again. Okay, so assessment, you carry it out within 20 minutes. The planning, you carry it out within 14 minutes. The implementation, you carry it out within 15 minutes. It has a 15 minutes timing to it. And the evaluation has 8 minutes that you expect to carry this out. That means in 8 minutes, you expect to evaluate your patient's care, what you've done so far, what you're recommending, and all that. We'll do SBAR properly anyways. So that is about the timing. Next one is that's about the timing for the API. Now for the normal skills, normal clinical skills. For the betting, we have 15 minutes. So in 15 minutes, you're expected to carry out a bet, usually second stage of labor. So they don't give you first stage, because first stage you're not doing so much, you're only doing auscultations and all that. So they usually give you second stage of labor to carry out a birth of a baby, on a lady that is laboring and in the second stage of labor. So you expect to carry this out within 15 minutes. If you're giving a postnatal check, like a postnatal lady, to carry out her assessment head to toe, you also expect to do this within 15 minutes. Okay. If you're giving the what's it called, the removal of urinary catheter, the removal of urinary catheter takes about 8 minutes. The intramuscular injection takes about 12 minutes for you to complete. All right. And then for the IV flush and VIP scoring system, you expect to carry this out within 12 minutes as well. So it's same timing with the intramuscular injection. Then for the abnormal births, the abnormal scenarios, they usually take 8 minutes each. So whether it's the postpartum hemorrhage or the unexpected breech birth or the shoulder dystocia, they take 8 minutes, except for the postnatal sepsis, which they've now changed to a 15 minutes thing. So because of the fact that they noticed, as a trend, that usually people don't finish this postnatal sepsis station on time, they decided to change it to 15 minutes from 8 minutes that it usually was or is. So it's now 15 minutes. The others still remain 8 minutes each. The postpartum hemorrhage, unexpected breech, shoulder dystocia, they are 8 minutes. Then for the what's it called now, the systematic examination of the newborn is a very full check. So they've changed this from it used to be a link skill whereby you do systematic examination and postnatal check. in a period of 25 minutes before. Now only the systematic examination of the newborn takes 25 minutes, meaning they've given you enough time for you to be able to carry out this skill, systematic examination of the newborn from head to toe. So in this skill, you're expected to check the baby head to toe, focusing more on the eye, the testes, the hip, and the heart. So if the baby is a man, a boy, you're expected to check the testes. If the baby is a girl, they will give you another thing to check. So you carry out assessment, focusing on two major ones in your example. You have four, generally. So you're focusing on either the eye and the heart, or the eye and the testes, or the eye and the hip, or the heart and the hip. They give you two places to focus on, but you have four, which is the eye, the heart, the hip, and the testes. So these are the four things they focus on. But you do head to toe examination of the baby. We'll be talking about it in depth, subsequently. Like I said, the systematic examination of the newborn takes 25 minutes to complete. And then the professional value and the evidence-based practice stations, which are the last stations, or the silent stations, they take 10 minutes each for you to complete them. They are written stations, so all you have to do there is to write and take note of it as well, that the timing. In fact, there's this thing we used to say then in our when we were practicing or preparing for our OSCE, that the time or the clock in the OSCE centers, they're usually shorter. They run really fast than the time in your normal home, your normal workplace, and all that. And this is the truth. It's especially different from the time in your workplace. So when you're doing these things, the time usually runs really fast. Like before you even finish saying hello to your patient, the time is gone, 5 minutes gone, 10 minutes gone. So you have to be really, really fast. Compare it to when you're at work, you're on a 12-hour shift. The time is running really slowly, like going really slow, back, 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 back. But talk about the time during examination, it runs really fast. Now, I think this is dependent, of course, on the need for the time. Because you're doing something within that time, it runs really fast. You don't know when, the time is over. But when you're at work, you're just probably sitting or carrying, and normally you want the time to run fast, but it runs really slow. So be mindful of these times, that even though you're giving, for instance, 25 minutes to complete a systematic examination of the newborn, that 25 minutes, take it as a 10 minutes for you. Okay, assume it is 10 minutes and do your things really fast. If you have time at the end of it, you can always go back to say, oh, I forgot to do this particular thing. Yes, you're allowed to say that. The examiner too, if for instance it was not an error you did, that's what they call viva now, they've recently introduced it. It was not an error you did, you just forgot to mention something. They can prompt you to ask you that, what do you want to do in this thing, or what have you not done, what they will prompt you. So this is called viva. It's all dependent on them anyways. It's not compulsory that they must prompt you. You're not the one to ask them to prompt you. They would, on their own, prompt you. But I'm just telling you now, in a normal situation, say you finished everything you're expected to do within the time frame, and then you forgot to say something, you can always say, oh, examine, I forgot to add this thing, examine, I forgot to say this thing. All right, so you can always do that. So try as much as you can to finish whatever you're doing on time. We will talk more about this, we will practice these things, and we'll talk about it, in details later. Okay, so running through the stations again, I said we have the first four, which is the API: assessment, planning, implementation, and evaluation. They're just testing your assessment skills, your ability to care plan, yeah, the plan care, ability to plan care for your patient, whether the patient is an antenatal patient, whether the patient is a labor case, like in labor, or whether the patient is a postnatal lady. You expect to care, plan care for this lady in any of these scenarios or situations. Then we have the normal midwifery skills, that you expect to carry out clinical skills and also carry out communication skills in these scenarios or in this station. So out of the 4 or 5 stations in this part, you expect to carry out 2 of them in your actual examination. So we have the birth, we have the postnatal check, we have the removal of urinary catheter, we have systematic examination of the newborn, we have the intramuscular injection, and we have the IV flush and VIP scoring system. Then for the abnormal, we have like, I think, 4 abnormals: postpartum hemorrhage, shoulder dystocia, unexpected breech birth, and then the postnatal sepsis. And you expect to carry out 2 of these in your actual examination as well. Then we have the last one, which is the silent stations. there are two stations: the professional value station and the evidence-based practice station. The professional value station has the bereavement care and safeguarding women and children as potential questions they can give you. They can either give you the bereavement care or give you what's it called, a safeguarding women and children case to plan or write a care plan about. All right, we'll talk about it later as well. Then the evidence-based practice, they can either give you a place of birth scenario or situation or question, or they will give you induction of labor questions. So it's either induction of labor or place of birth that they will give you as questions in the the evidence-based practice. They're expecting you to carry out to talk about your knowledge of evidence-based situations, guidelines, your knowledge of guidelines, your knowledge of evidence, your knowledge of care in these areas, in the place of birth and induction of labor. Why? For the professional values, they want you to see how best you're able to take care of a lady or plan the care of a person, you know, applying your professional knowledge, your professional values. Like, you're doing this in a professional way. You're including diversity, don't worry, we'll do more of this in details. I don't want to make this video too long, but this is all there is to know about the OSCE generally, like an overview of what the OSCE examination is all about. The price of this OSCE examination is £794, and if you're doing a receipt, say you're receipting about 7 stations or less, you pay £394. But for the full one is about £794. Then for the result, the timing of the result for when it should come, I expect to see your results like within 5 working days. If, for instance, you get your results and you find out that you failed one of the stations or two of the stations, and you know that you did well in that station, you can always apply for a receipt as well. Not a receipt, rather, you can always apply for a remarking. Sorry. So you can always apply for a remarking when you notice that you failed the station, that you were sure you did the right thing there. Okay, you were sure that you did the right thing, but they failed you. You can always apply for remarking. Is it that it comes out good or bad? They're not going to charge you for remarking. They're not going to punish you or penalize you for remarking. So that's that about that. You have a maximum of 3 times to sit for the OSCE examination, after which we'll have to start the process all over again. Meaning that if you fail it this first time, you write again, you still fail some of the stations, you write again, you still fail the same stations, you will start your process all over again, meaning you start your verification all over again, start, everything all over again. All right. I hope I've made this as clear as possible. Just to round this up, to tell you that this thing is not something like you're coming in front of a court to defend yourself whether you're right or wrong. It's just a way to express the things that you already know, express your skills, and also it's combined to also help you to get introduced to the UK system, because these things, like I said at the beginning, you're going to be doing them every day in your care planning, in your practice. You're going to, carry these things out every day. I used to say that the UK system is sort of like a robotic way of care, being that the things you do is documented. All right, it's documented. Like, you have guidelines, hospital guidelines to follow. So everything you're doing is based on what is in that hospital guideline. You're not doing something outside of it. Say, for instance, the hospital guideline or policy or this thing says a patient is expected to I don't know which scenario to give in particular now. A patient is expected to have blood pressure monitoring done, and blood pressure monitoring and temperature only. And before that you used to do blood pressure, temperature, respiration, and heart rate before in your home country. But in this hospital now, they're telling you only have to do blood pressure and temperature. And they give you the reason why you have to do only this blood. It's always evidence based. One good thing about the UK system is that it's always evidence based. There is an evidence backing up why they are telling you to do something. So when you've seen your hospital guideline, this is what it's telling you to do. You do it accordingly. You're practicing safely in that regard. All right. Yes, you're a midwife. You have skills. You have things that you're expected to think about, critical thinking and all that. But most of the time, you're following hospital guidelines to do something. Okay. So be rest assured that whatever you're doing, you know, like these things before. you even know too much before. Okay, you're going to learn more, definitely. You're going to unlearn, relearn, the learning, all the learning kind of things you want to think about. But you know these things before. That's just what I want to explain to you. You know them before. You're just carrying them out in a more advanced setting. You're just getting used to the UK system. It's not a scary thing. It's not a scary exam. When you're in that exam situation, that day in that exam hall, do the things as though you've been doing it before. Well, of course, with the practice you're going to, do now, the practice you're going to carry out, the questions, the scenarios and all that, do it as though you're doing it in a normal setting at home. This is just all it's all about. They're testing your clinical skills, they're testing your communication skills, they're testing your ability to involve the patient under your care in your care planning, that you're not leaving the patient aside and planning care. Who are you planning care for? Is the patient you're planning care for. So you have to involve that patient in that care. You have to seek consent. You have to do hand hygiene. All of these things are what they're trying to assess you on. Your ability to carry out hand hygiene, your ability to involve the patient in decision making, your ability to seek consent before you carry out care, your ability to introduce yourself appropriately, your ability to, hand over care in an S-bar format, because that's a recognized or standardized way of care handover. When you're doing your care in your normal, say for instance, you pass your OSCE, you've been employed, you're working in an NHS trust. When you're doing your care plan, your handover, you always do it in an S-bar format. And this OSCE, they're telling you to do it in an S-bar format because they know you'll be carrying it out every day in your practice. So you just have to learn this thing. If you're not used to it before, you have to learn how it is done calmly. Learn how it is done calmly. Don't beat yourself up. Don't tell yourself, oh, this thing is a death sentence, this. It's not really that difficult if you settle down to do it. It's not that difficult if you settle down to learn it. All right. We'll be doing more about it. We'll be talking more about it. If I have any other information to share with you about the OSCE or any of the states, I will definitely talk about it again. So don't fret, calm down, and as we start the stations, as we start the learning, I wish you all the best. Thank you so much for watching. Bye.